Mixing and administering of piggyback. Check physician's orders and MAR.
So again, I'm going to check my orders, compare them with my MAR, and I see that I have an order for crafty powder to be mixed in 100 milliliters of normal saline.
Check for allergies.
I'm checking my MAR to make sure my patient's not allergic to the crafty powder, and I find that they have no allergies, so I'm okay.
Wash your hands. Mix medication according to directions.
So you can look on your vial, you can look on your MAR to determine what the appropriate reconstitution is. This medication says it's 3 grams to be mixed in 100 milliliters of normal saline, which is what I have.
Okay. Check medication order with medication label using triple check.
So again, I checked it when I got it out, checking it against the MAR.
Check drug compatibility and administration rate using drug reference.
So again, I'll be looking this up in the drug book, and I'm making sure whatever solution I have running in my primary is compatible with my secondary. And I found that it is, so I'm okay.
Mix medication according to directions.
Okay, so with this, you're going to pop the top off. You're going to clean it with alcohol. And then you're going to pull this foil off. And then this has a little spike in it. It's going to spike this. You push it on there. And then you have to actually break this seal. So you just flip it back and forth once. And then you will be able to squeeze your saline into there. You can mix it gently. And then you squeeze it, turn it upside down and squeeze it, and it will come back into the bag. And I usually like to rinse it out once just to make sure that I get all the medication. There shouldn't be any chunks left, and you can shake it as hard as you need to. Okay, so I have it mixed. Now I would need my orange label, which I do not have for this demonstration, but you would put your orange label here signifying that you have mixed this medication. And it will say what medication has been mixed, what time it was mixed, when it expires, and the rate of infusion.
Attach administration set to secondary container.
You're going to open your tubing. As we do before we hook any bag, we're going to roll the roller clamp to close this tubing. We will remove and then remove our cover from our spike. We're going to spike the secondary set.
You label tubing.
Again, you'll label your tubing just like we did for your primary tubing.
Take MAR and equipment to bedside. Identify client. Wash your hands.
So you're going to take your secondary bag with your tubing connected, your hanger clip, and an alcohol wipe. We're going to the patient's room. We're going to verify. We have Kelly Eglin. We're going to check against the MAR, verify that she has no allergies, verify date of birth, and then we're going to verify again the medication is correct with our MAR.
Wash hands.
Wash the hands again.
Clean primary port with alcohol. Remove cover from lever and insert lever into the highest port.
Your secondary is always going to go into the highest port, closest to your bag. So it's going to be this port here. Cleanse it with alcohol. We're going to remove the tip here. And it just pushes down again and then screws on.
Open regulator on secondary and backfill the secondary set by lowering the secondary container.
Before I do this, and this may be a little bit off of your checklist, but you're going to want to hang this bag lower with that blue attachment device that comes with your tubing. So you'll hang it lower, then you're going to release the roller clamp and we're back priming. We hold it lower than the level of the primary bag. And then we'll flip it up.
Hang secondary container on IV pole. Lower main intravenous bottle using the extension hanger.
And again, I said that was probably deviating from your checklist, and it was, but you'll want to make sure that your primary is hanging lower than the secondary. Otherwise, your primary will infuse, not your secondary.
Regulate rate for secondary container using regulator on main set.
So you will use this main set to calculate your drips per minute. You are not going to be touching this. Once you've back primed, you're never reclamping this. Otherwise, you're going to get yourself in trouble. You'll forget to unclamp it. So never reclamp this. Always use your primary to calculate your drip factor.
Verbalize return in approximately 15 minutes to check rate if not on pump. Return when med is finished infusing. Wash hands. Document properly on IV flow sheet and mark.
So I would know this medication should hang for 15 minutes or a half an hour, and I'd come back after 15 minutes, make sure it's infusing. Before you ever leave the room, you should make sure that your secondary drip chamber is actually dripping. Okay? So I'm going to come back in 15 minutes, make sure it's still going. I'll come back in after my half an hour. It's infused, it's done, it's completed. I can clamp it off, throw it away, or I can leave it hang, that's fine. And I'm going to wash my hands and document my recording, hanging my medication.